So diaphragm, pelvic floor, you can see this is called scissors syndrome because it opens like a pair of scissors. This person might have tight quads and tight lats, and so the axis, instead of being horizontal, open, and this is what it looks like when they are horizontal, and you can see again how the low back is stabilised by the cylinder. Very, very important slide. It should feel like the diaphragm is pushing to the pelvic floor and the pelvic floor is pushing to the diaphragm, so that down arrow and up arrow is enough for you to get this understanding. If I'm in scissors syndrome, this is what I mean when I say chest position down. So it only makes sense if you lengthen the spine first and you reach away with the crown. And keep going. Now, this purple structure is the diaphragm, and this wiggly thing in here is the tendon it travels down on. So when it travels down on the central tendon into a flattened position, and then that's on an in-breath, and then on an out-breath it returns to its dome shape. When we use it in the way I'm suggesting, it will be slightly more flattened, which also means your lungs are on more stretch. But that anatomy of the diaphragm is really important to understand why we get this widening effect with good stability.
And a good way to see that is to look at your dog, especially if it's a young dog or animals in the field, not ones that are probably old and been sitting around in the house a lot and become more humanised, but quite animalistic animals, you'll see them, everything expands, they'll breathe everywhere without even unconsciously doing it right.
You look at a cheetah or a gazelle at top speed, this head-reaching way is profound. As Glenn says, it's just alive in particularly wild animals. The transverse abs run this way, horizontal, the diaphragm runs this way, so they're a perfect horizontal into vertical structure. And the way we know gravity is through the perception of up and down. And you might say, of course, but I'm talking about from a living perspective. So right now, if you tune to up and down, basically your body changes, your attention changes, because you're not looking to escape from life by being on a holiday in a daydream or whatever it might be. Another good example of the horizontal aspect of the transverse abs that you've probably heard about. The multifidus is just a deep spinal muscle because it just spans one lumbar vertebrae at a time, and so it's part of, if you like, this is the front aspect and this is the back aspect. So the multifidus is the deepest of the spinal extensors. That shows your psoas that I mentioned earlier. There's your lumbar spine. It goes from the lumbar spine to the femur, and that's how we lift the leg. Importance of stabilising the low back so that can happen. Now Glenn was asking about the other trunk muscles. So these red muscles here assist on an inhalation, and the blue muscles assist on an exhalation. So we've actually, if we see our anatomy from this breathing perspective, it's very, very helpful. So the red muscles open up the ribs so that the air can come in, and the blue muscles close it down so the air can be pushed out. Okay? That's the trunk on the pelvis to the legs. So if I'm going to do this, to be able to do this, the way the trunk is on the pelvis to the legs determines my recruitment. If I want to have big forces, I need the right recruitment strategy. I can't have the right recruitment strategy if I don't have deep system.
Recruitment is going on the right muscles.
Yeah.